now that we're kind of on the back end of things and we're getting vaccinated and people are reevaluating their lives and where they want their careers to go, keeping in mind that non-medical folks out there don't, it's not in their wheelhouse. It's not that they're ignorant. It's that they don't understand all of the things that we've been through.
Yeah.
And, giving everybody some grace. We hear about kids being homeschooled. Our kids, our teenagers, our young adult men and women, they don't have the coping skills that some of our older populations do, because things are all so much different, and they grew up in an era of technology already, and then we just further transitioned and took away any kind of human contact.
Are you sure you weren't destined for psychiatric nurse practitioner? Because that's one of the things that we really work on a lot in my house, is trying to remember that our kids, this is a very, very difficult experience for them. This is a very difficult experience for all of us adults. Have some kindness and grace for each other, really just try and be the best human being you can. And, you're not always going to get it right. But
no.
If I yell at the kids or my spouse, I try to apologize. And I try to give myself some breathing room to decompress if I need to. These are all just important life skills, honestly.
Yeah, and I mean life skills. So you take you or I. We're grown adults. We have been highly educated in several different institutions. We have a long-standing career, and you have stepped away from not just ICU but CRNA. And now you're doing amazing work here. Myself, educator, ICU nurse, 33-year experience, bedside nurse, now moving away from bedside.
Yeah.
Those are monumental shifts and changes, and my hope is that everybody out there understands that it's okay to not get it right every single time, but be teachable. You asked me before about if I had any advice for a newer nurse coming into this profession in this day and age now, and or even to somebody who's looking at changing careers.
Yeah.
And if there's any advice I could give you or them is remain flexible, teachable, give yourself some grace, take your vacations, educate yourself. That's my go-to is education. Educate. And you can educate yourself in a lot of different ways.
You certainly can.
You can go to a formal school. You can take an online class. You can talk to somebody who is an expert in a different department.
Yeah.
I'm going to be educating. I'm getting educated in my new role because I'm going to be learning all about how to manage open heart patients and how to support those nurses that are taking care of open heart patients, in addition to all the other ICU nursing.
That's, you said it so well. One of the things that's, and everybody talks about this, leaving the ICU to go into anesthesia as a CRNA, one of the hardest challenges is going from being an expert in one realm to a complete, I hate to even say novice, because you just don't know anything, and starting completely over. As Angie was saying, when you're an ICU nurse, it's usually a great working, very collegial working environment. You're well respected among your colleagues, the other providers that you work with, and then to start over at the bottom was probably one of the most challenging things I've done. And so I applaud you for making a huge shift as well.
Thanks.
And, learning to manage open heart patients. That's something that we didn't do a lot where we worked, but it's a very challenging skill set. And they're very sick patients.
Yeah.
So that's going to be amazing.
I'm so excited.
I bet.
I'm so excited.
And this is such a typical perspective of an ICU nurse and so many healthcare professionals that are constantly seeking to improve and improve themselves. We're so difficult on ourselves, and that's something that I hope we learn to do is forgive ourselves when we make mistakes. Be honest about them, apologize, and always try to learn and improve. Be flexible.
Yes.
Love that. Be teachable.
Absolutely.
Huge. And be adaptable.
Absolutely. The more rigid you are, the narrower your perspective. And if there's anything that I've learned along the way from some of the most amazing nurses I've worked with and physicians, is if you are not teachable, you actually rob yourself of further opportunities. And what drives that a lot is fear.
Yeah.
Fear of failure.
Yeah.
Fear of making a mistake. Fear of not getting it. Nobody wants to be labeled unintelligent or incapable. And when you take that risk to jump into the pool to learn a different skill, a different type of nursing, or a different role altogether, which is kind of what I'm doing.
Yeah.
It can be terrifying, but you just got to look it in the face and do the best you can do and remain open to that education.
Yeah.
I'm so excited. I can't
bet.
stand it. I'm so excited.
So this is textbook. This is a textbook demonstration of one of the key concepts of this YouTube channel is Angie's making a huge shift to live her best life. She realized it was time for a change, and change is never easy. It's always difficult, but some of the best rewards in life come from making these big changes.
Yeah. I think there's a lot of truth to being so uncomfortable you can't stand it anymore to finally make a change.
Yeah.
Thank you, COVID. You made me so uncomfortable. It was time for a change.